Well, I would say it's rather a myth associating chronic back pain with the injury, because in by and large, most of the chronic back pain conditions have been associated with degenerative changes, meaning thereby wear and tear of the small bones or ligaments or joints around the spine and long muscles which are on both sides of the spine. So these are the most common causes. Apart from these, there are certain other medical conditions. Out of these, you can talk about common one being osteoarthritis, rheumatoid arthritis, and certain immunological disorders such as ankylosing spondylitis. They are pretty common. However, there are certain rare causes as well, such as infection, a tumor, fracture. These are the rare one. So I would say it's rather a myth saying that chronic back pain is always associated with an injury. Most common things are very trivial, just musculoskeletal muscle spasms or wear and tear in the small bones or joints in the spine. Invariably, severity of the chronic back pain has been associated with the progression of the underlying cause, which are, as I just mentioned, most commonly are degenerative changes, wear and tear, or inflammatory process which goes on in the small bones, joints, or ligaments in your spine. Very rarely there would be a cause or any sinister reason causing the seriousness of the pain. However, it's very important to seek an expert opinion, and if necessary, you would require certain investigations, MRI or blood reports, to establish the cause if your pain is not getting better or severity is worsening. It's rather rude to say that if there is no physical sign, pain must be psychological. Evidence suggests that with the chronic pain, patients invariably develop psychological symptoms such as chronic anxiety or depression. Besides, with the ongoing pain and chronicity, our brain pain centers, they get sensitized, and they can perceive the trivial pain very severe, which is called hyperalgesia, such as just the touch can be perceived as a severe pain. This is in medical terminology called central sensitization. So chronic back pain can develop psychological issues, and patient may perceive intense pain despite of the absence of any physical signs or problems. So it will be really cruel or rude to say that patient doesn't have any problem, or in fact the pain is just in the brain or it's psychological. One has to establish the cause of the pain, or on the basis of patient signs and symptoms, and on the basis of the ongoing management, and should establish the overall holistic pain management, such as the based on biopsychosocial approach. That is what recommended as well. Well, I would say just sitting, mere sitting, of course, cannot cause chronic back pain, but it all depends on prolonged hours of repetitive sittings or awkward posture which you are adopting while sitting for long hours. Certainly, in recent circumstances whereby most of us are forced to sit in front of the computers, say for education, for gaming, or for professional reasons, we invariably tend to slouch our back or droop our shoulders or bend our neck. So these kind of awkward positioning and long hours of sitting can provoke neck and back pain. But sitting per se, for a little while, not necessarily you can say that it does elicits or provokes your back pain. If someone is going through acute, severe flare of pain, it will be really it wouldn't make sense to say that person to continue work when the muscles are in severe spasm or patient is suffering with the very bad pain. Of course, someone should take rest at that time, because this could be due to the precipitation of progression of underlying inflammatory process. So recommendation of for adequate rest for 3 to 4 days, and use of anti-inflammatory medications and topical ointments is always recommended in this scenario. However, if the pain continues and the severity goes worse, and the patient is not getting any benefit, in fact, you are developing some sort of other signs and symptoms such as fever or muscle weakness or severe sciatica pain, which is going down to your leg, certainly you should seek expert opinion, whereby you would be assessed properly on the basis of the signs and symptoms, and if possible, certain investigations such as MRI or blood test or CT scan, whichever is appropriate, to establish the real cause of the pain, what's going on, and then you would be recommended the appropriate treatment option at that point. Of course, when you start activity after initial period of rest, it should be a gentle start and build it up gradually. Guarding and pacing of the activity is always recommended under pain management strategies for prolonged and chronic pains.